Welcome back to another edition of the Heart to Heart podcast. And my guest today is Payton Nyquvest from Numinus Wellness. So Payton, welcome to the show.
Thanks for having me.
Did I say your last name right there?
That sneaky V, it's Nyquvest, but the V, I feel like I either gotta edit it out or double down on just starting to pronounce the V as well. But Nyquvest.
Sorry, I kind of butchered that one.
All good.
But obviously, I know you as the CEO of Numinus, but there's a lot more to you than that. So can you give the audience a little bit of a brief background about yourself?
Yeah. Like many people, got involved in, it always feels weird to call it like the psychedelic space. That doesn't necessarily feel appropriate, but was fortunate enough to have the use of psychedelics save my life. Was someone who suffered with severe chronic pain since birth, and at a young age recognized that trying to live with chronic pain was not a way that I wanted to live my life. So kind of in my early to mid teens, got very passionate about not just physical health, but this intersection of mental health. And, then the kind of layers associated with that. But got myself to a point a number of years ago where I kind of felt like I had tried everything. And really wasn't getting, while I was kind of on this path, my chronic pain actually continued to get worse and worse. And so I was getting hospitalized about 3-4 days a week and was kind of out of options.
And what was the pain from, Payton?
Yeah. So the best way I can explain it would be, it would kind of start as gut pain that within 30 minutes would just turn into just the overwhelming just experience of pain. And then it was kind of a race to the emergency room, before, trying to debate whether to take matters into my own hands or not. But, that's kind of how that process would unfold. And then kind of on the other side of that, when I could get the pain under control, then there was a whole bunch of kind of autoimmune issues that would kind of flare up after that. So that was the process.
So it was mostly abdominal pain then you were experiencing?
Yeah.
Okay.
Yeah.
And did they give you an official, you don't have to, say anything but did they give you an official diagnosis or anything like that? Or
that was the most kind of disparaging part. Was I'd been diagnosed with just about everything, to then find out that wasn't the diagnosis, to the point where at one point I remember I was dealing with one gastro person who, very highly regarded, who was dead sure that it was Crohn's or colitis. And I remember he handed me like a 350 page kind of Bible on those kinds of indications. And I hammered through the whole thing, made a whole bunch of notes, and then we did a bunch more tests, and it turned out not to be that. And I remember in that moment, I was angry that it wasn't that. And I remember my partner, now my wife, said to me, like, let me get this straight. You're upset that you don't have like a, lifelong, potentially lifelong illness. And I was like, well, I just felt like at least I knew what it was. And so I never actually got a diagnosis for it.
Yeah, it's got to be frustrating when you have some type of pain, especially when it's affecting your function and your quality of life like it did with you, and then you still don't have, an official diagnosis for it. I guess, the only good thing about that is that you did somehow find some medicines that did help treat your pain or your symptoms. So maybe you can tell us a little bit about that and which treatments you use that were best for treating your symptom management.
Yeah. So, kind of the things I found kind of before, and I'd grown up in a family that struggled with substance abuse. So I'd actually never had a psychedelic experience. I was kind of trying to be the anti-recreational drug person. And really, as I kind of continued to, I found a lot of modalities, at least in regards to managing my mental health as a part of this, that I found really helpful. We were talking about EMDR just before we hopped on, but, was working with therapists in a bunch of, somatic therapy was really helpful for me because of the chronic pain symptoms. But in terms of like physical management, tried every diet, tried, really anything I could find, and nothing was really providing a lot of relief. And so, one of the things that I felt, especially towards the end, the emergency room near my house got so used to me ending up in there. And I remember I'd land in the emergency room, I'd be writhing in pain. And, the first thing they always reach for is hydromorphine or something like that to try and just kill the pain. And I remember like I'd be pleading not to get like that. I know that's not going to give me the solution. I know that's, and it's it's a bizarre thing with those kind, opiates and those kinds of drugs where, it makes the pain go away so quickly that even it messes with your head, and you go like, was that even real? Was that, was I making this all up? Like and I think what ended up happening, fortunately, I'd had so much education around substance abuse that I never used any of those drugs outside of the emergency room. But I think eventually my body just became dependent on it. And that was one of the things I started to notice, like as I was more and more frequently ending up in the emergency room, it was almost like, is there a dependence here that I'm not even factoring in? That is, just that my body knows where the source to get that is. And
was there a moment, Payton, when you felt like, you know what, I'm not really treating my abdominal pain anymore. I'm kind of just seeking out opioids because I know that they make me feel better?
I didn't even realize it, honestly, until after the fact. And that was like the thing that I realized was this is persisting and getting worse, and I'm ending up here more, and I don't want to do this anymore. And that's actually the moment when I turned to psychedelics. And for me, the first psychedelic that I worked with was ayahuasca. And I remember
the first one.
I went straight to the deep end of the pool. And I remember I was sitting in the emergency room, and I was just like, this is, I got to do something drastically different here. And frankly, psychedelics were pretty much just the only thing I felt like I hadn't used yet. And so I actually booked my flights while I was in the hospital, got out of the hospital. I went down to Costa Rica was the first place that I went to. Yeah. And, cool. Packed my bags, got on a plane, flew down to Costa Rica. And, I kind of made a deal with myself flying down there. I was like, this isn't going to work or I'm done. And not to paint the picture of a panacea, because I'd say, the work really started when I got back, but 1 week with ayahuasca, and I never had any chronic pain symptoms ever again. And
that's insane.
Yeah, it's
crazy for a couple of different reasons. So first of all, I'm really happy that you're chatting about this, because 99% of people, and maybe that's a little bit too high, but most people who use psychedelics are trying to treat mental health, and chronic pain does go hand in hand with mental health.
Yeah.
But I haven't had too many people that have come on the podcast and said that they've used psychedelics purely for chronic pain, like physical symptoms of pain reasons. It's mostly been for, trauma kind of therapy and that kind of stuff. So, it's interesting to, talk to someone who's had such a wonderful experience using ayahuasca to treat their chronic pain. So has there been any research, either scientific or anecdotal research, in how ayahuasca can treat chronic pain?
I mean, nothing outside of a lot of anecdotal reports, obviously. But I think, kind of interestingly, if you look at even the MAPS results with their MDMA work, one of the indications kind of just below PTSD that they saw a huge amount of benefit for was chronic pain. And I mean, treating a lot of veterans who obviously, a large percentage of them who were there for PTSD also were suffering with pain symptoms and stuff like that, and they have seen a lot of relief in their pain symptoms also. So there's a fascinating correlation there for sure.
Yeah, I think that we should, definitely explore this a little bit more because, as you've kind of, explained and experienced, we don't have the best treatment options for chronic pain. Like, sure, opioids can be exceptionally effective and they can work very quickly, but they can also be highly addictive and can cause a lot of issues in the long run. So, I think that we should, we need more studies for it on mental health, but we definitely need to now look at it more for physical health and for treating chronic pain as well. So thank you so much for sharing that, Payton. I really appreciate that.
Yeah.
One thing that I actually did want to ask about with regards to MAPS, and I asked this question to most people that I talk to about psychedelics. So I've kind of become a little bit curious as to, what psychedelic may be the best for any particular ailment. Meaning, if someone has PTSD, is MDMA going to be better than, say, someone who has depression? Maybe psilocybin will be better. So I know that you're very well connected in the psychedelic community. You're friends with Rick Doblin of MAPS, and you've chatted, I think, with basically all of the who's of who's are in the industry. With that being said, do you kind of feel that the psychedelics now are being brought to the mainstream and it's being more accepted by the average person?
For sure. And almost, I don't want to say at an alarming rate, but I think, even in just culturally, there's so much conversation about psychedelics. Like I can't go to get my hair cut without, hearing people talking about it. I was driving down the street the other day. I see Aritzia's got pictures of mushrooms in their, windows, and, it feels like it's kind of everywhere at the moment. I think there's still, at least in my experience, there's still a lot of misconception around, I would say, the use of psychedelics and how they're being used, or that we get the amount of people who still call Numinus on a daily basis asking us if we're selling mushrooms is pretty alarming. And so I think there's a lot of conversation about it, which is positive. I think, and you look at like the MAPS results, which, frankly, I don't think get nearly enough attention in regards to, it's incredible what they're coming up with. And it really speaks to not just the use of psychedelic drugs as a tool, but it also speaks to, the therapeutic container and the process and all that really goes into it. And, it's really something that why we created Numinus was, yes, we want to be able to broaden access to psychedelic therapy, but the psychedelic intervention itself is a small part of really what's needed to make this effective for people. And you hear the term integration used a lot lately. That's accurate, but also preparation is extremely important. And I think for people to really realize, like, these are not panaceas. They're not magic pills. They don't fix all your problems. They're tools that can definitely, really advance things for you. But the work still applies, and there's still a lot of work that needs to go into not just the experience itself, but before and then after, potentially, for the rest of your life, potentially. And I think people need to be aware of that. And hopefully, more of that starts to come into more mainstream media.
Yeah, no, that's a really good point. And that was the question I was going to, ask you is, do you think that psychedelics sometimes are seen as a panacea to kind of, solve every issue? Because, it kind of sounds hilarious that someone actually thinks that, they're going to do ayahuasca one time and they're never going to have any problems again. It's crazy. So like, that's, not going to happen. And again, we both obviously strongly very believe in psychedelics as a therapeutic medicine, but it's not going to solve everything on its own. So I do have a couple questions about integration that I do want to ask, but In terms of someone, if they're looking into, setting up some kind of retreat or they want to take psychedelics, like what do you think is the best approach for someone to do it safely in terms of preparation, during the session itself, and then anything afterwards that you think may be helpful? And I know the afterwards part is the integration part, so I can ask you a little bit more about that specifically afterwards, maybe just in the immediate sort of like 24 to 48 hours afterwards.
Yeah. I mean, it's a big question. I mean, I think depending on, there's so much literature out there. There's so much research out there that people can get educated on, which I think is really important. I think that one of the challenges, and even with I'm always happy to share my story, but I always really try to preface with, while it sounds like this magical, thing that happened, the truth is far less glamorous on both sides, and so I think for people, when you're thinking about preparation, there's a lot of people, a lot of therapists who have become very informed in regards to the use of psychedelics. I think really, really determining why, first and foremost, why you're seeking that kind of work, and again, really factoring in the work that's associated with that. So, the amount of people that I know who now jump to using psychedelics, but they've never talked to a therapist before. It's kind of like going to climb Mount Everest, but you've not even started going hiking in your backyard yet. And so I think, and a lot of people are really desperate. A lot of people feel like, I don't have the time to do that, but it's an important part of the process in terms of, finding safe places. Obviously things like ketamine are now available as a psychedelic therapy. And, we can talk a lot about that and different kind of models and stuff. But I think first and foremost is, there's good practitioners out there that are very psychedelic informed, that can at least give you some education, give an understanding of what goes into it as you prepare. Going back to the question you said around indications, I think what's interesting, there's a lot of research being done on different indications. As you said, MDMA for PTSD, psilocybin for depression, LSD for anxiety. And we're the sites for pretty much all of those clinical trials at the moment. And I think this sort of like path around indications is important, but I think also you have to look at the individual, right? Someone who's very hypervigilant and, and has a different presentation versus someone who, is maybe more depressive in nature. Like, I think that's also an important part. Someone who's very easy to get overwhelmed, you throw them into a high dose psilocybin session and it just might be too overwhelming for them. Right. And so
I agree. I'm not sure if this has been, teased out in the research that you've done, Payton, but it seems like for me, like psilocybin is good for people who have really low motivation.
Yep. And
MDMA might be a little bit better for people who are, I guess, have a little more trauma, sort of like trauma-based mental health. And not that, if you have depression, you don't have, trauma, but it seems psilocybin really helps people, I find, like get out of bed, so to speak, in the morning. Yep. Whereas MDMA might be a little bit better for making you cry and kind of making an old memory not painful anymore.
Yeah.
But again, like these are total just like anecdotal things that I'm sort of just like spitballing right now, but I'm not sure, Payton, if you kind of seem to be in agreement with those kind of statements. Like, is there any other light you can shed on that? Or
yeah, no, I agree with that. I think even the use of ketamine, particularly for depression, ketamine is interesting in regards to some of its dissociative effects as well. Kind of gives you a bit of a zoomed out perspective, which is good. If you're someone who naturally disassociates, that can be tricky territory, right?
Yes.
We essentially, and I think this doesn't get talked about enough either, but ketamine so far is really the only psychedelic that we see has a potential for abuse. And, there are a lot of people who have ketamine addictions, and we have to be really cautious of that, because again, if someone is oriented towards disassociation, here's a drug that can make that happen for you. And
Yes.
and I think we have to be really, really careful about that.
I agree. So I don't know if you know this, Payton, but I do quite a bit of ketamine assisted psychotherapy, meaning that I'm the prescriber, but someone else obviously does the psychotherapy. So Dr. Tatiana Zib is one of the clinical psychologists that I work with a lot, and from mind setting. And so, with ketamine, the way I do it to make it safe, one thing that is helpful in the way that I do it anyway is I only prescribe for people orally. So this is a good and bad thing. So the bad part about it is that, and which is also the good part, is that it's very, very poorly absorbed orally. Yeah. So if you have, a meal of you in any kind, even if it's within the past like couple hours, so maybe if you haven't eaten for 2-3 hours and you take ketamine, like you're probably not going to feel anything, so that way it's inconvenient for people to take, because essentially you have to have an empty stomach in order to take the medicine. But the good part about that is that, for the most part, people aren't fasted all the time. So if you do have access to oral ketamine and you're addicted to it, well, you're not going to get too addicted too quickly if you don't absorb any of the drug and you don't feel any of the effects. But you are, it can be addictive, and it does cause these, dissociative effects. And, people always ask, what does, ketamine feel like, and it's impossible to describe, what a drug feels like. It's like someone asking, like, what does it feel like to smoke weed, or what does it feel like to, drink alcohol? Like, I don't know, I feel more relaxed, I feel happy, but like, you can't really feel that, like, you can't really, say the exact feeling of it. But dissociative is definitely the best term, and that's what I describe with my patients as well. Some people do feel like it's a very light alcohol intoxication, but I don't know if that's just because it does produce maybe a little bit of dizziness and nausea, which is also associated with alcohol. But the effects are still being teased out actually with ketamine, because I know you're a fan of Andrew Huberman. I saw you retweet him on my Twitter and stuff. Not to go off too much on a tangent, but he did indicate recently that there was a study done where they gave people an opioid blocker before they gave them.
Saw that. Yeah, really interesting.
Yeah, and then when they gave them ketamine, they didn't get the effect, which means that potentially maybe the antidepressant effect and the brief, sometimes longer chronic pain effect may be due to opioid receptors, which is kind of interesting because it's long been considered, it is an NMDA receptor antagonist. A lot of people thought that was the mechanism of action, but another study too on ketamine recently, there was one done on ketamine versus anesthesia, which you may have seen. And basically they produced roughly the same results, meaning that whether you took anesthesia or whether you got ketamine, your symptoms of depression or anxiety or mental health improved significantly in that study. And I think what that is it just gives people like a little bit of a break, so to speak. We talk about, MDMA receptors and, blocking the opioid receptor and, all this kind of science fun stuff. But at the end of the day, like, how does it actually work? I think it generally just gives people a little bit of a break in their brain, like they're able to stop thinking for a bit and they're able to kind of, shut that down. And maybe it has a little bit to do with the default mode network as well. I'm not entirely sure about that one, but it is a very, very, interesting medicine. And, but you are right. Like if there is some abuse for potential on that, we do need to be careful about it.
Yeah. And I totally agree with you around this kind of break that it gives people. And again, going back to preparation and integration is, utilize that break, right? Take that space to go and process, whatever is causing you to be in the room in the first place. That break is a window of time for you to go and try and process some of that. And that's, I think really important, especially when we're talking about ketamine, is, the substance is just the tool to give that opportunity to go in and go and do some of that work and process, again, whatever's causing you to be there in the first place.
Yeah. And I like how you're using the word process. And I also tell people, I say to my patients all the time, capitalize on the energy, because it's like, you haven't been out of bed or you haven't been out of your house for, a long time, you're feeling low. All of a sudden, now you take a medicine and you feel better. Don't just sit in bed or sit at home and, enjoy it. I mean, maybe you can do that for a little bit, but the goal is really to get back doing whatever it is that you want it to do. So I'm not saying during the ketamine session, but after the ketamine session, when you're feeling good, like go for a walk, get outside, get some sun in your face, go lift weights, like do something to initiate momentum. And, I think that once you get the momentum initiated, then it's a little easier to keep going. I'm not saying it's way easier, but it's definitely a little bit easier. Like once you're working out 4 or 5 days a week, to work out 4 or 5 days a week the next week is easy if you've been doing it for a year. But to initiate it is very, very difficult. And I think that's where, psychedelics really come into play, is they can help with the initiation part. Like some people are just, unfortunately, they're so depressed that like they can't get out of their bed or they can't go to the gym, that kind of thing. Yeah. And I don't think there's anything that you're going to take forever, like one pill, one time, where like every single day then for the rest of your life, you're going to feel better and you're going to feel motivated. Like, no, that's crazy. But what psychedelics can do is they can be a catalyst and they can help with that initiation and that initial motivation to get you on track so that you can keep up with motivating yourself every day and get into routines and habits that, build a healthy lifestyle. Because essentially when you're looking at someone who's, depressed versus someone who's not depressed, you should be looking at their habits. And the people who are depressed, they're probably going to be self-isolating, not exercising, not eating well, not socializing with friends, not getting out of the bed, not even working, chasing the dreams, whatever it is. Whereas, someone who is, very happy and healthy, so to speak, they're going to be exercising, they're going to be, chatting with friends, they're going to be working, they're going to be doing those things. So, what you want to do is really, once you have that energy, is focus on positive behavior changes that you can incorporate into your daily life and then make those things a habit. And it seems like that's like the message that you're trying to send out, Payton, like you've been kind of talking about it the whole podcast.
Yeah. And really across the board with all psychedelics. And I think, you even see this, with things like ayahuasca, right? Like the amount of people I know who are, racing off to do ayahuasca ceremony, 350, meanwhile they can't figure out where their car keys are and life at home is still a mess. But I think that's an important thing, is why are you using these things in the first place? Because they can also be a great distraction, right? You go in and you get the psychedelic pyrotechnics and I'm communing with whatever, and I'm getting these insights and all this kind of stuff. And it can be about the experience, and we can forget the whole point of using these things is to come back and be able to live the highest potential life that's available to you. It's and I think that's really important. And it's interesting, and I'm curious your thoughts on this, but you've seen this kind of, now we talk about psychedelics and there's this constant use of the term medicine, right? We call them plant medicines. We call whatever you want to call them. And I have a couple of teachers who, come from some traditional lineages, and they always say, we never called them medicines. We called them plant teachers, or we called them master plants. And it was this, we have this interesting relationship with this word medicine in North America, where as long as we use the word medicine, it's a good thing, right? It's, I'm doing the medicine. It's like, well, hang on a minute. Like, And so we have this kind of interesting relationship with that word a little bit. And I see a lot of that kind of coming into the use of psychedelics. And I'm curious as someone who's practicing, I'm curious your thoughts about that.
Yeah, no, it's a great question. I mean, I do think we have to be careful about using the term medicine. And when you use the term medicine, basically you're trying to treat an ailment, right? There's something that's wrong, or there's kind of disease or something, and then you're taking the medicine and then you're getting better. So for some, and this is where it maybe gets a little bit tricky, because for some people are using ayahuasca as medicine. They have, like you had some very severe physical pain in your abdomen, and then you took the medicine and it went away. Perfect. But if you're someone who, his life is a bit of a disaster, you said you can't find your car keys at home, your life at home is not good, maybe you're not taking care of yourself very well, and you're using ayahuasca as a medicine, then, I don't really think you're using it, and I'm using air quotes, people are watching, as a medicine, then I don't think you're using it appropriately at that point, right? Then you're kind of just using it as a bit of an escape. And, I understand this relationship quite a bit because of my dealings with cannabis. And cannabis is certainly can be used as a medicine, and it can definitely be used as a recreational distractor. And I mean, that is without question that, I've seen people with seizures using CBD oil, they no longer have seizures. That's medicine. But I also see, teenagers who wake up in the morning and start using high THC and don't stop until they go to sleep at night. And that's not medicine.
Yeah, that's perfect. Thank you.
So, I think that, as long as we, use medicine to treat something, if someone's getting better, that's okay. But if someone's not getting better, maybe the term medicine should be used to like recreational use or something like that. One question I have for you that's, just talking about cannabis actually, and, cannabis was legalized here in Canada in 2018. Now we're in 2023. And there's a lot of people who, are curious about the legalization of psychedelics. I think people think that mushrooms in particular will probably be the one that will first be legalized. And in your opinion, Payton, do you think that mushrooms should be legalized, or do you think that it's best to keep them as a prescription, say from a physician, or how do you think we should deal with this?
I think it's interesting. One, again, going back to MDMA, if you look at where MDMA is at in the kind of clinical trial process, MAPS anticipates that being available in sometime kind of, I would say this time next year. And so things are advancing rapidly there. I think psilocybin's an interesting one. You've seen Colorado, Oregon, a couple other states start to move towards a legal therapeutic model for psilocybin, which I think is good. I get asked a question all the time, like, do you think the medicalization path? Do you think the decriminalization path? Do you think, legal path? And, my answer is always just yes. I think they're all good for different reasons. I think the thing, again, going back to what we were talking about before, I think the thing we just have to be really cautious about is, humans are going to do human things. And I think to just say, everything for everybody without any education can be dangerous. And even with cannabis, like the kind of unfortunate thing that I continued to see in cannabis was, especially up in Canada, where it was sort of this intention of like a medical path to begin with, and then very quickly made way for a recreational path. And when that happened, research essentially halted. There was very little work that was being done to try and figure out how to use cannabis again as a medicine. And I think we lost a big opportunity there. And instead it just became this recreational product. And, to your point, now there's these recreational products that are out there that are like, I'm from Vancouver. I grew up around cannabis a lot, but some of these products, like the amount of THC that's in these products and stuff like that, like it's crazy. And again, we've lost this opportunity to really figure out how can we work best? How do we create the best relationship with this substance so that it's able to be healthy? And is there a place for recreational use? Sure. But I think we have to be careful about that. And I think with psychedelics and things like psilocybin in particular, there are certainly people that definitely should not touch psychedelics. As we know, people with potential for bipolar disorder, schizophrenia, those kinds of things. And, there's some interesting literature about that, but I think it comes back to timing, right? Like, and setting, this idea of like a bad trip, which people talk about. I don't necessarily agree with this idea of bad trip. I think there's definitely bad preparation and bad setting that could lead to a very, very challenging experience, and I think we just have to be really cautious about that.
Do you think even too, though, with a bad trip, there may even be some therapy in there? Like
absolutely. Yeah, the harder my experience, the more I get out of it. But I'm in an environment that is able to like actually help me through that. I'm not with like a couple of friends in the woods, who are not able to help me kind of go through and process this kind of stuff. And I think that's what can lead, again, to this idea of bad trip or potentially bad outcome is again, I always say like, I wouldn't do open heart surgery with some person that I just, saw on the side of the street that's never done that before. And so, these experiences are big and can be very profound. But again, if not in the right environment, can lead to harm for sure.
Yeah. I mean, one thing too, we that Rogan and I talked about when I was on his podcast too, was, sometimes when you have these, we were talking about cannabis in particular, but even when you are feeling like a little bit paranoid or, just kind of feeling uneasy, you could say, with cannabis, like maybe there is, something therapeutic even about that in and of itself. Like yep. Maybe it's surfacing some things that, you need to deal with that you haven't dealt with in the past. So, I think that just because you feel uncomfortable doesn't necessarily mean that, you're having a bad trip or that the medicine is giving you what you don't need. Because we know that classic line, I forget who said it, but, sometimes psychedelics give you what you need, not what you want. Right. And so, we have to, I think take that into consideration when we're going through these trips. And, one thing to see in the drug development space, and Payton, you probably know a lot more about this than I do, because I'm not, really, I'm not as high up on the new drug formulations that are coming out in the psychedelic space. But my understanding is that they're really trying to develop new medicines where you're basically not going to have any feelings of uncomfortableness. Like you're more or less going to have the good without the bad, which sounds amazing. And maybe that is good for some people, maybe those medicines will be good for some people, but I am a little concerned that, by removing it completely or changing the structure of the molecule, that perhaps you also are taking away some of the therapeutic benefit. But again, I'm not against like these new designer drugs that are, trying to essentially like take away some of the side effects from some of the drugs, because some of the side effects that are taken away are not even related to the mental health. Like for example, with MDMA is technically an amphetamine, right? So, if you have a heart condition, you can't take amphetamine, which is unfortunate. So for those kind of people, I, absolutely agree with, trying to reduce those kinds of physical symptoms. But I have some concern, I guess, about trying to reduce just the uncomfortable or the uneasiness or their paranoid aspect that kind of comes with these medicines. Sometimes that does provide a bit of a therapeutic benefit.
Yeah. And we actually have good, for me, I started to see a lot of drugs where the narrative was, like psychedelics without the psychedelic effects. And And I was kind of like, spoken like a person who's maybe never had a psychedelic experience before. And we have really good data that actually the depth of the psychedelic experience does actually contribute to more positive outcomes. It's an important part of the process that people go through. To your point around uncomfortable, and this is just me, my first ayahuasca ceremonies, there was no visionary pyrotechnics. There was none of that. It was actually me back stuck in my pain for, a number of nights. And, that was where the work was. And I think it's important that, to your point, I think those challenging experiences are important. There's something that we're needing to pay attention to, that attention is being drawn to, and to even just the what comes from an experience of overcoming these challenges and getting through it and feeling better on the other side. It's kind of like a micro experience of maybe on a broader level, what people are actually being challenged with in the first place. Hey, can I get over my stuff that is causing me discomfort? And so I agree. I worry about, there's especially for people who haven't had psychedelic experiences, which, there are a large majority of people who haven't, that can sound really appealing, right? No challenges, even, it's interesting. We were looking at this in our lab, even around, removing maybe some of the nausea from psilocybin. And, on one hand, I think there's some benefit to that, but on the other hand, that nausea is there for a reason. And, it's even talking about the use of psychedelics. Mother Nature's done a pretty good job of creating these different substances over the last, however millions of years that they've been around for. And, even you look at the use of these compounds, there's now, I think I was just down in Peru at a place called Ketamine, and they've been using Wachuma or San Pedro in ceremony there for now 7,000 years. There's a lot that they know, and their concern was not how do we make this less psychedelic. It was how do we utilize this experience in the best way possible.
Yeah, I totally agree with you. Like I said, for certain specific things, like if someone has, a high heart rate or some heart condition and, you want to give them a safe MDMA experience, that's cool. But I think that we do need to be really careful about taking away some of the psychedelic experience, because that can definitely take away some of the benefit. But one thing I was going to ask you, Payton, was, so, you dived right into ayahuasca, your first trip. You just mentioned that, you had a little bit of pain initially when you started it. So during the trip and during the first couple days after, like, were there any times when you thought to yourself, holy shit, what the fuck did I do? Like, what did I get into? Like, why am I doing this? Like, this is crazy. Like, now I'm throwing up, I'm shitting, and like, I still have this abdominal pain. Like, did any of those thoughts kind of come into your mind?
The whole time. Again, it's not this sort of like glamorous, and I think, it's easy to hop on YouTube and there's some trip report of some person that's talking about, all of the, again, those sort of psychedelic pyrotechnics that have its place, but also can be a bit of a distraction. But, to be honest, one of the most challenging things that I went through was, I didn't have a community of people around me who had used psychedelics before, and, came back from that experience. And, as someone who'd suffered with chronic pain my whole life, I come back and it's like, how do I even relate to myself anymore? Even from a time perspective, I'd always look at my week, be like, I'm probably going to be in the hospital 3 days this week. Right. And it's like, how do I relate with myself? Even with my family, right? My family, their relationship to me was Payton with chronic pain. And now, I come back a week later and I'm like, oh, well, that's gone now. And people are like, what are you talking about? And so it was it was actually a really isolating time. It was a really challenging time. And fortunately, I done a lot of work with mental health and I had good practices around that. But it was really hard to come back and try and just, we want to try and make sense of these things always. And I think that can be a little bit, sometimes it's not to be made sense of. Sometimes, to what we were talking about before, there's a window of opportunity there, and take it, go and do the things that are going to benefit your life. And so interesting path. Yeah.
So, you've talked about integration quite a bit, and obviously, you've done that successfully. You're not someone who doesn't know where their car keys are and are doing ayahuasca.
I still lose my car keys sometimes, but yeah.
But you've done the ayahuasca, you've integrated things. So what did you do in your integration that was successful?
Yeah, I touched on this before, but and people hear this a lot, but I can't underscore the importance of, I was fortunate enough to find community pretty quickly. And I was fortunate enough to find a space where, I could talk about these things and people, while they didn't know my exact experience, they had a general understanding and kind of helped me normalize the experience a little bit. That was really, really important.
Who don't have maybe too many friends that are in the psychedelic space, like, would you then encourage them to sort of seek out maybe, Facebook groups or that kind of thing? Or
they did Facebook groups, but also, again, there's, and again, this was why we formed Numinus, was how do we create space and access to people in people's backyards where, whether they're having one of these experiences in a Numinus location or whether they're having it elsewhere, there's someone that they can come and talk to that can help them kind of unpack things a little bit and work through it. And for me, that was, the other thing that was really, really important for integration was I was able to find a therapist who knew about these experiences and can kind of help me move through it. But also, I think for myself with chronic pain, the feeling of like symptoms being gone was so acute, where, I think where it's a challenge with mental health is, that can be it can be a little ambiguous for a little while. Even people with mental health issues sometimes go through these like seasons, and it's a little bit of a roller coaster. And, even with things like depression, some people don't feel depressed all the time, but they have these bouts of depression, right? Whereas with chronic pain, it was like pain was there, now it's not there anymore. And there's like space associated with that. So that was something that was a little, again, a bit more acute to my chronic pain. But, the things that you mentioned too, like just figuring out how I want to live my life now, whether it's, making sure I'm going to the gym or getting some exercise or, being in nature and those kinds of things. Like I think we want to always try and we want to forget the practical things and with these experiences that can be so vast and expansive, we want to try and equally with integration, we want to marry up. And this is where you see this sort of like a little bit of sometimes we get lost in just the day-to-day, right? And it becomes about the experience. And now I'm this person that experiences these things and an ego almost gets created around that too, which we have to watch because can be another distraction from, again, how you living your life? How's day-to-day going? Are you feeling good about all those things? Or are we just again, falling into another pattern of distraction from day-to-day life.
Is there any specific habits, Payton, that you do now that you weren't doing before?
I'd always kind of had different things. For me, the things that are really like, I call them like non-negotiables, but I have some non-negotiables. Like I have a meditation practice that I start every day with, I end every day with.
Which use that?
I don't use an app anymore. I encourage people, whatever works, like don't overcomplicate it. Whatever allows you to sit with yourself for a period of time, I think is important. I think
5 minutes, sir.
I do 20 minutes in the morning and 20 minutes at night.
Wow, that's good.
And that's just what works for me. I think, again, people, there can be a little bit of this like performative, like, oh, I'm doing the 20 minutes. I'm doing the 20. It doesn't matter. If I could do what I do in 20 minutes in 5 minutes, I'd do it in 5 minutes. But 20 minutes is just what works for me. And other things that I do every day. But I almost don't like to talk about this now because it's become a thing. But cold plunge for me I've been doing that for about 7 to 10 years. I grew up in Vancouver, so there's lots of cold water around. But that every day for me, if we could prescribe cold plunge for people, I think that'd be the best that we could do.
You just get a cold shower, or do you have a plunge? Or
I have a cold plunge now that I use that gets down to like 36, and I'll do that for 5 minutes. 5 minutes. Yeah.
That's pretty good. Like I see like you follow Huberman just as much as I do, but I think he says like even 2 or 3 minutes is good. I mean, I do it in the shower right now. Eventually would like to get a cold plunge. I have a sauna. The major advantage over the cold over the sauna is that the sauna is time consuming, right? Like when I get in there, I'm there for 30 minutes, right? Which is, almost as long as like, a cardio workout, depending on what cardio workout you're doing. Yeah. Whereas like when you just get a cold shower, it's just part of my day already. Like I'm just washing my hair with cold water instead of warm water. Yeah. But I mean, I think it makes a massive difference. Like, Huberman's talked about before, but like the dopamine production, increased by 2 to 2.5 times for roughly 2 to 6 hours or even longer. Like it's definitely a big thing. And that's a non-negotiable for me. And one of the other ones I have, 5 minutes of sun in the morning. And again, I feel like I just keep talking about Huberman this podcast, but that's I got that from him as well. But that's a pure non-negotiable for me. And I usually read one passage from the Daily Stoic. Ryan Holiday's Daily Stoic. That's a great one. And I try to read his emails. So I won't say I do it every single day, but I do it most days for sure. Nice. Yeah. So, and I think that's good to be, it's good to have like some non-negotiables, like hard non-negotiables. But then it's really also good to have a couple sort of like soft negotiables. Like if you don't hit it, it's not that big a deal. But for me, like sun in the morning is huge. Like I just find that makes a massive difference. And I know I keep repeating it, but don't wear your sunglasses when you try to do that. The whole point is like, I think there is some, effect of it hitting your skin. There might be some, minor hormone production or something like that. It's probably just related to, but with regards to the sun in the morning, why it's so important to get in your eyes, because your eyes are part of your central nervous system. So you need to get it in your eyes in order to kind of get that circadian rhythm flowing and to make sure that you're getting all the benefits from it. So very. So I know we don't have too much time left here today, and we haven't really chatted too much about Numinus. So maybe tell us a little bit more about Numinus. And I know you kind of already explained why you started it, but maybe just tell a little more about Numinus and what we can expect to see from Numinus in the future.
Sure. Yeah. So Numinus, really, as we've talked about, was created not just to provide access to psychedelic therapy, but really when we talk about psychedelic therapy, all that really needs to go into that for, it to be really effective for people. So good preparation, integration, support, and kind of all the modalities that go along with that. So we're up to about 13, 14 locations now in Canada and in the United States, where we do a lot of traditional talk therapy. We do TMS, ketamine assisted therapy. Up in Canada, we help change the special access rules up in Canada. So we've been able to offer psilocybin assisted therapy for some people. And then the kind of other side of the business is we're a clinical trial site management organization. And so we're the clinical trial sites for pretty much every major psychedelic clinical trial. We've been the sites for MAPS, Compass, USONA, MindMed, a bunch of DMT studies. And that kind of gives us an opportunity, obviously, for patients who are looking to enroll in a study, we can provide access to that. But two, we run those studies in our own clinics. And so kind of gives us a little look around the corner to see what's coming. And that helps us kind of ideate and innovate our clinical model based off of what we know is coming. And we worked MAPS in particular, we've worked really, really closely with over the last number of years. We actually just recently announced an experiential training trial to be able to offer an MDMA experience to practitioners who want that experience, which we believe is very important. And we've now built a whole kind of training tree around everything from people who don't have any therapeutic experience that want to start learning and start being trained to be a psychedelic therapist to people who, have experience. And then we've kind of branched it out into different compounds as you move through that pathway as well.
That's very cool. One thing, I know we're getting real short on time here, but one thing that, just that I want to mention, this is very, very cool. I thought that you mentioned how a lot of the therapists want to do the therapy itself, which is very interesting. And again, I know we only have a minute or two left here, but like most physicians who prescribe antidepressants are not on antidepressants themselves. I mean, I'm sure some of them are, but it's probably just whatever is the, however many percentage of people are on antidepressants, the general population is probably however many, what is the same percentage as the physicians who are giving it out to patients. But if you look at therapists, I bet almost 100% of psychedelic therapists have used psychedelics themselves. And in your experience, has that been the case that you've seen, Payton? Is that most of these people who are doing it itself have used it?
Most for sure. And maybe, going back to your question around if I'm someone who's looking to do psychedelics or do psychedelic therapy, who should I reach out? Find somebody who's done psychedelics themselves, first and foremost. We can't mandate people do their own psychedelic work if they are a psychedelic therapist. My personal opinion is, I wouldn't get in a plane with anybody that hasn't flown a plane before. And I think I do think it's extremely important, even, to understand the nuances of someone going through a psychedelic experience, as we talked about earlier, a challenge that someone might be going through in the experience. The other side of that challenge might be the thing that they need to break through. And if you don't have context for that, you can jump in and try and stop them from having this challenging experience or get in the way of what might present the most amount of healing opportunity for somebody. So I do believe that, if you're going to be a psychedelic practitioner, having that experience is extremely important.
Yeah, no, I totally agree. Like if you want to learn how to lift weights, learn from someone who also lifts weights and lift weights themselves. If you want to learn, from someone who with psychedelics, learn from someone who has done psychedelics themselves. So I think that's a beautiful way to end it, Payton. But can you tell people where they can find you online, where they can learn more about Numinus and everything that you're doing?
Yeah, Numinus.com. There's lots of resources on there, and on social. We're Numinus on all the social channels, and then just myself, Payton Nyquvest, on all the social channels as well.
Awesome. Payton, thank you so much for coming on. I really, really appreciate it. Everyone who's listening, thank you so much for listening. And as always, I'll be back again next week.
Thanks so much.